Well, I have a special place in my heart for deep brain stimulation. It's a very effective therapy, and it's always been extremely rewarding to work with patients with deep brain stimulation because the moment we turn it on, we can often see so many different changes, sometimes very quickly, other times progressive improvement over time, but the degree of benefit and the kinds of benefit that we see are very rewarding. It's also a very exciting technology interface where technology is constantly changing, and so the kinds of innovations that have come to the space continuously evolve. We have now 3 companies making deep brain stimulation products where just a few years ago we just had 1 in this country. A lot of different tools as far as directional leads, leads that may be able to sense what's actually going on in the brain and dynamically adjust to that. So it's going to continue to change, and it's very exciting right now. There is a limited pool of patients that are eligible for DBS, but it's a lot greater than those who actually do find DBS as a therapy for them. I think the biggest challenge still is patients becoming aware that they could be a candidate, they could benefit from this therapy, and doctors making the referral for them to get deep brain stimulation therapy. That's still the biggest challenge that we have. Generally, patients with advanced dementia or other medical problems that preclude them appreciating the benefit from the therapy wouldn't be candidates. But otherwise, patients who normally get a good response to levodopa and other medications, but that response is getting shorter and shorter and less predictable, are typically good candidates for deep brain stimulation. I'd say the only exception to that is some patients have fairly severe tremor with Parkinson's that can be very stubborn and not respond to the medications, and those patients tend to do well with deep brain stimulation as well. In fact, it might be their best and only option to get good control of their symptoms.